You are in your 7th month and you only have 9 weeks left to go. You are over 3/4 of the way through your pregnancy. In this video, we are going to be talking about baby development, symptoms that you might be experiencing, including leg swelling, varicose veins, and how to prevent them, and so much more. So if you're new here, my name is Diana. I'm a physician assistant. I specialize in women's health and gynecology. You are watching In the Pink. And if you're new here, In the Pink means in good health and spirit. So if you like being healthy and happy, click subscribe because you are in the right place. By now, the baby is about 16 inches long and weighs about 3¼ pounds. They have almost reached their full delivery length, but will continue to grow about ½ pound a week. In other words, right now your baby is really tall and skinny, but they are going to continue to gain weight and fill out and are already starting to look more and more like a newborn baby. They have hair and fingernails, and that fine downy hair that I talked about earlier that they develop earlier in your pregnancy to help keep them warm, called lanugo, that hair is starting to fall off because their fat cells are now helping to keep them warm. Now, something cool that we've learned is that the baby's eyes can now track light. And one of the ways that we know this is that their irises will dilate and contract depending on how much light they're seeing. Their eyesight is still really blurry, but they can detect the light that penetrates through your belly, which I think is pretty amazing. The baby has sleep-wake pattern. So this means there are times when the baby is awake and moving around and more active, and there are times when the baby is asleep. So usually during the day, when you're walking around, the baby tends to spend a little bit more time asleep, probably because of your movements that rock them to sleep. And usually at night, that's when they tend to be a little bit more active, especially when you are trying to go to sleep. And I just want you to be aware of those patterns so that you don't get concerned when the baby is sleeping during the day and you're wondering why the baby isn't moving. And there is a way that you can reassure yourself that the baby is doing well through something called kick counting. Now this is where you count how long it takes for the baby to kick 10 times. The baby should kick or punch or move 10 times in at least 2 hours. So you want to pick a time when, the baby is usually very active, and then start counting the baby's movements. Often, especially if you've picked a time when the baby is really active, it might only take a few minutes for the baby to kick 10 times. But if the baby doesn't pass your kick counting, meaning they didn't move 10 times in 2 hours, don't panic. They're probably just sleeping. So what I'd want you to do is wait till a time where you know that they're going to be more active, get a big glass of juice or something really sugary that often makes them wiggle a little bit more, and then lay down and then really pay attention. If the baby then kicks 10 times in 2 hours, you're fine. If not, give your OB or your midwife a call, tell them what's going on, and then they can help you decide if you need to be seen or not. Even if they do ask you to come into the office, almost always everything is still okay. As for you, how are you holding out? Your belly is getting bigger, and I know you're probably feeling more tired. You probably aren't sleeping well thanks to all of the aches and pains that come with pregnancy. So just drop a comment down below and let me know how you're doing. On week 30 video, I talked a little bit about varicose veins, but today I'm going to talk about how to prevent them. So when you're pregnant, your body produces hormones that relax your veins. Also, your growing uterus puts pressure on the large vessels that go from your pelvis and your legs up to your heart, called the VENA CAVA. And also, your body increases its blood volume to help with the pregnancy and with the delivery, which is, great. But the problem with all of this is that it puts pressure on the veins in your legs and causes those veins to dilate or enlarge. These are called varicose veins that can really be quite painful sometimes. They feel like bouncy, long, squiggly tubes, but sometimes you can't feel them with your hand, but you just feel achiness, burning, itching, pressure in your lower legs or in your pelvis. These are very common, and not just in pregnancy, but for many women, about 50% of women develop them in their lifetime, and about 40 to 50% of men do too. Now, if you develop them during your pregnancy, many times they disappear a few months after you've delivered your baby. But now let's talk about how you can prevent them. Number 1, exercise. It is totally fine to exercise during your pregnancy. In fact, I encourage my patients to exercise, but be sure to check with your OB to make sure that they are okay with that. There are a few circumstances where your OB or midwife might not want you to. For example, if you're contracting or if you're bleeding, they might ask you to rest. Number 2, wear compression stockings. Now these are kind of like medical stockings and they are tighter than regular stockings, but the compression is gradient, and that means that they are tighter at the ankles and get a little bit looser the further up the legs that they go, to help make it easier for blood to get back to your heart. Now these aren't mine. I know, attractive, right? I wore compression stockings with all 4 of my pregnancies, all of which were summer and early fall deliveries, and I admit there is no air conditioning in these, and they are not the cutest under shorts, but definitely worth it in the long run, and I'm going to link to them in the video description down below. Check them out. Number 3, change positions frequently. If you have a job where you are sitting for long periods of time, make sure you change positions as often as you can and stand up and walk around frequently. Number 4, elevate your legs as often as you reasonably can and avoid crossing your legs. Number 5, make sure to drink plenty of water. Number 6, avoid excess weight gain. Now this is a tough one. You know, firsthand, it's not that simple. We are going to be gaining weight with a pregnancy no matter what, especially in the 3rd trimester, and we are tired. Sometimes don't sound good to us and we need extra energy, and eating perfectly is kind of difficult during pregnancy. I totally get it. So just, you know, do the best that you can, but just be aware that excess weight gain can increase your chances of developing varicose veins, among other medical issues. So just something to keep in mind. One other issue that you might be experiencing because of the increased pressure in your legs is leg swelling, and that is very common during pregnancy as well, especially if you're in your 3rd trimester during the summer when it's really hot outside. For me, like I said before, that was the case with all 4 of my pregnancies, and to help with that, many of the same things that I mentioned to prevent varicose veins can help with leg swelling as well. And I want to particularly point out, sometimes it sounds counterintuitive to drink more water to help with the excess water in your legs, but it does in fact help. So if you are experiencing a lot of leg swelling, don't cut back on the water. In fact, if you aren't drinking as much water and you are becoming a little bit more dehydrated, that can sometimes trigger your body into having more contractions. Also be aware that different pregnancies might bring on different problems. So for example, I had 2 pregnancies with 0 leg swelling. My 3rd pregnancy, I had horrendous leg swelling. For about 3 months, I couldn't wear anything but a pair of really loose sandals. It was a little bit uncomfortable. My kids thought it was hilarious. But then with my 4th pregnancy, no swelling again. I don't know. It was kind of weird. But just so that you know, whatever you experienced in one pregnancy does not mean that you're going to experience it in another pregnancy. But with the leg swelling, as long as it's both legs, it's pretty typical. It's safe to say that it's probably just because of your pregnancy. But if you were having leg swelling just in one leg and the other leg is fine, that could be a symptom of something more serious, especially if you are having pain and redness in that one leg. If you have symptoms like that, you need to call your OB right away or go to the emergency room if you can't reach your OB. Those could be symptoms of what's called blood clot in your legs. Blood clots in our extremities are called deep vein thrombosis, or DVTs. Definitely talk to your OB or midwife right away if you have any of those symptoms. If you want to know more about common skin problems during pregnancy, I talked a lot about that last week in week 30's video. And if you want to know more about Braxton Hicks and preterm labor, I talked about that in week 26. But I will be talking more about that next week. So be sure to hit your notification bell so you don't miss that video. And if you're new to my channel, I highly recommend that you go back and check out some of my earlier 2nd trimester videos. I cover a ton of good information that you really want to know. And hey, if there's another topic that you would like me to cover, I hope that you put that in the comments section down below. If you know anybody else that's pregnant, share this video with them. Hopefully it will help them as well. Right here, I will link to my playlist of pregnancy week by week. Click on that playlist right here, and I will see you over there. At this point, most OBs want to start seeing you every 2 weeks. So let's talk about why they want you to come in more often and what they are checking for. So at your appointment, they will usually check your weight,